Good evening, my name is Mike. Together with my Tiger teammates from Georgia Tech and Emory, we are LymphaTech, and we are improving the lives of breast cancer survivors. Imagine that you, your mother, your wife, your grandmother just survived breast cancer. Now imagine, as a result, her arm has irreversibly swollen 8 times its normal size. This incredibly debilitating disease is called lymphedema, and LymphaTech has the solution. There are 2.7 million breast cancer survivors in the US, 250,000 new ones every year, and half of them will get lymphedema in their lifetime. The big problem with lymphedema is any swelling is permanent. There is no way to reverse it. And there is a treatment for lymphedema. There is a treatment. But that treatment has to begin before swelling begins. There's a big problem, right? The biggest problem, this is literally the state-of-the-art of diagnosis for lymphedema, a simple tape measure. This is ridiculous and unacceptable. It can tell you your arm has swollen, but at that point you already have lymphedema. It is too late. You have permanent tissue damage. If lymphedema is not caught early, it can result in very serious clinical manifestations. A lymphedema support network has identified an early-stage lymphedema diagnostic as the single most critical advance that's necessary in lymphedema care. And that's where LymphaTech comes in. We have a patent-pending, revolutionary technology that for the first time allows doctors and clinicians to actually visualize lymph flow in the body. This is what they're looking for. This is what they need to improve the standard of care. Combine this imaging technique with a simple pressure cuff, and we can get a lymphatic pumping pressure metric. This is a blood pressure measurement for your lymphatic system. Altogether, we can generate a quantitative lymphatic health score. This tells you specifically what your disease risk is for lymphedema. Altogether, we can diagnose lymphedema 6 months before symptoms occur. Early diagnosis, early treatment, prevention of lymphedema. Why is this a good opportunity? Why LymphaTech? Why now? Doctors want this technology in their clinics today. They want to be able to improve the standard of patient care. Patients really want it. They're telling their doctors, we need this. They spend $250,000 over their lifetime to treat lymphedema. A preventative will help reduce those costs. Healthcare providers, there's $110 billion spent annually on lymphedema-related expenses. A preventative diagnostic will dramatically reduce those costs. They are desperately looking for a technology like LymphaTech. Finally, there's a regulation that's about to go into effect that will mandate all breast cancer survivors get regularly screened for lymphedema. There is currently no technology on the market that can do this screening. LymphaTech can do this screening. We're a very strong interdisciplinary team with 20+ years experience researching lymphedema. We know the problems, we know the people, we can get the product in the hands of the doctors to revolutionize the lives of lymphedema patients. We are LymphaTech, and we're improving the lives of breast cancer survivors.
You cited that there was $110 billion spent annually on lymphedema care. That number to me seems really high.
Me too.
What does that encompass?
So one of the big problems that's kind of unknown about lymphedema, there's a lot of depression that goes along with it. So they lump in mental health visits. They're really at risk for infection. So it's a lot of things that are from lymphedema that end up being related costs.
Adjacent
Right.
fallout.
But if you can stop the lymphedema, you end that trend.
What other applications does this technology have beyond
Yeah, great question.
or
Active area of research, in fact. It is a platform technology. It can be used for kind of some vein imaging, some improper venous return. That's really not where we are yet as far as, this is kind of the minimum viable product, the easiest entry point. But there are definitely other applications for venous imaging, for sure.
Explain to me, are you targeting doctors or are you targeting healthcare providers? How do you see selling this?
Yes, very good question. So we're selling it to healthcare facilities, hospitals, doctors' offices, practices like that. But it's really the entire continuum of care. You have purchasers, you have customers, you have users. We have a whole strategy to kind of deal with all the points on that. But yeah, the device will go into the medical practices, in the doctor's offices, oncologists. We can correlate it with their regular follow-up visits for their breast cancer screening. It works very well.
So this is something that could be done in the doctor's office and would save a patient from going to a hospital?
Exactly. All in one visit. Takes about 10 minutes.